Hi, I'm Robert Christensen, owner of Amada Senior Care in the Pacific Northwest, and today we're going to do a little bit of training on a very important topic, and that is making a call to a long-term care insurance carrier to validate the benefits that are available for a policyholder. This is a critical step in what we do before you go out and see a policyholder. Actually, before you make any decisions on the plan of care and what the insurance policy will cover, it's important to take this step and so that both you and the policyholder have a good understanding of what their policy is going to cover when you start care. So I'm going to show you a couple of materials. This is our brochure that we leave with nursing homes, with hospitals, discharge planners, and anybody that gives us referrals. This is our marketing piece that shows the complimentary service of reviewing a policyholder's benefits. So in here you can see the steps that we'll do, and I'm going to go through each one of these. The form that we're going to be filling out during this process is our long-term care insurance form that goes over all the policy benefits for home care and facility care. And also, prior to going out to do the assessment and meet with the client, what we've done is we've uploaded all of the documents into a tablet, and on the tablet you'll be able to fill all this information out, and so when the client signs, you can then go ahead and send it over to the office and they'll have all the benefits. So we're going to go ahead now and do a call to a long-term care insurance carrier for a Mr. Fotheringham. Mr. Fotheringham, come on in here. And we're going to validate his long-term care insurance policy. So we're going to go ahead and make that call right now.
Hello, you've reached Long-Term Care Insurance Company's claim department. My name is Michelle. How can I help you today?
Hi, Michelle. My name is Robert Christensen. I'm sitting here with Mr. Fotheringham. He's got a long-term care insurance policy, and we are doing a complimentary review of his benefits so he has a good understanding of what his policy will cover.
Okay, sure, no problem. And what is your name again?
My name is Robert Christensen. I'm with Amada Senior Care.
And is there a number I can reach you at in the event we get disconnected?
There sure is. 555-555-1234.
And for verification purposes, your tax ID, please.
45-12897.
Okay, and what is the policy number you're referencing?
Policy number is 555-555-555.
Okay, and is Mr. Fotheringham available?
He is. I'm with him right now.
Mr. Fotheringham?
Hello.
Hi, Mr. Fotheringham. For verification purposes, can I have your date of birth and the last four of your social security number?
My birthday is January 1st, 1975.
And your zip code?
98123.
And what is your home phone number, sir?
253-867-5309.
Thank you, Mr. Fotheringham. Is it okay if I discuss both financial and health care benefits with Mr. Christensen?
Yes, that's okay.
Great, thank you. Okay, Mr. Christensen, Mr. Fotheringham has approved you to ask questions about his policy. This authorization is good for 24 hours. How can I help you?
Yeah, I'm sorry. I didn't get your name again.
My name is Michelle.
Hi, Michelle.
Hi.
I really appreciate you taking the time to help Mr. Fotheringham better understand his policy benefits. His policy, does this policy cover both home care and facility care?
Okay, and one more time, what is that policy number again?
It's 555-555-5555. Lots of fives.
Okay, yes, you are correct. And let me pull up some information. Do you mind holding a moment?
No problem.
Thank you. Okay, Mr. Christensen?
Yeah.
This policy does cover home care and facility-based care.
Well, great. So the daily benefit, what is his daily benefit amount?
Okay. Do you mind holding one more time while I pull that information up?
No problem.
Thank you. Mr. Christensen, I have that information. I'm showing that his daily benefit amount is $150 per day.
All right. Now, is that paid out on a weekly basis or a daily basis or a monthly basis?
Please hold while I pull up that information as well. It's The policy shows that that is paid out on a monthly basis.
Okay. Now, for for facility, if he chooses to go into a facility, does it pay out on a daily basis or on a monthly basis for facility care?
Just one moment, please. Per the policy that we are referencing, it shows that it pays out on a monthly basis.
Okay, a monthly basis, that's for home care, correct? What about for facility care though?
That is for facility care as well.
Okay. Are you sure? Because I'm looking at it here with this policy and it looks like it actually pays out on a daily basis for facility.
Hold on just one moment, let me verify. Thank you for holding. You are correct, Mr. Christensen. It does pay out on a daily basis for facility care.
Okay. So what's the multiplier on this policy?
Hold just one moment while I pull up that information. Okay, I have that information. It shows that his multiplier is 730.
Okay. And so what would his maximum benefit be?
I'm showing the maximum benefit amount allowable on this policy is $109,500.
Okay. And does it have an inflation rider on it as well?
Just one moment while I verify that information. Mr. Christensen, I am not showing an inflation rider on this particular policy.
Okay, great, thank you. When was the policy taken out? I guess I just need the day and month. I don't need necessarily the year.
Okay, I'm showing that the anniversary date for this policy is April the 1st.
Okay, great, thank you. The elimination period for this policy, what's the elimination period time?
Hold one moment while I pull that information up. Per this particular policy, Mr. Christensen, I am showing the elimination period is 90 days.
Now, those days, are they actual days or are they 3 days equals 7?
I am showing that per this policy that it is 3 days equals 7.
Okay. So, and as far as the week, does the week start on a Sunday? Is that correct?
Yes, sir, that is correct. It starts on a Sunday and ends on Saturday.
Great, thank you. Okay, so the elimination period, does it have a one-time meets for him to meet his elimination period, or does he only need to satisfy his elimination period one time during the life of the policy, or does he have to satisfy it for each event?
Please hold while I pull that information up. Thank you for holding. I am showing that the elimination period only needs to be satisfied once.
Great, thank you. Now for facilities, I'm looking at, his condition he may need to go into a facility. And so help me better understand his benefits for facilities. Will his facility allow him to go into an assisted living facility and a skilled nursing facility, or is it a skilled nursing facility only?
Okay, per the verbiage in the policy, it will cover a facility-based care. Facility-based care is described as a nursing home and or assisted living facility.
Okay, so what is the definitions on the assisted living facility? Does it have any set criteria in the policy to define an assisted living facility?
Hold on just one moment while I pull that information. Yes, there is a requirement for the adult living facility. It must have at least 3 residents, provide 24-hour care, provide square meals, provide meals for special dietary needs, medication management, have 24-hour access to a doctor or RN for medical emergencies, must have proper licensing by the state, if the state has a licensing requirement.
Okay, great, thank you. Now, he has spent 60 days in the nursing home and just came home. Will his time in the nursing home count towards his elimination period?
Give me just one moment while I pull that information. Yes, sir. That time in the nursing home will count toward his elimination period.
Okay, great. What about if he receives home health? Will the days that home health comes in and provide care when they bill Medicare, will that count as well towards his elimination period?
No, sir, it will not.
Okay, thank you.
Message, well, first I just tried to call you back.
Now, does he have a premium waiver on this policy?
Give me just one moment to pull up that information. Per this particular policy, he does have a premium waiver after 90 days of care.
Okay, so when he goes on, his wife is also on the same policy, and they have a combined premium that they make each month. So when he goes on, when that policy goes on waiver, is both his and his wife's premium waived?
Give me just one moment, let me look at that. Yes, I am showing that the waiver is for both him and his wife, as long as one of them are receiving care.
Great, thank you. Now, on here, does he have a restoration of benefits as well?
Give me just one moment. Yes, per this particular policy, there is a restoration of benefits if the client is free from treatment for at least 6 consecutive months.
Okay, great. Now, when he comes home, he may need to make some modifications to his house. Does this policy have a home modification rider on it?
One moment, please. Per the policy, there is no home modification improvements.
Okay, great, thank you.
Do you have any other questions for me today?
I do, and I know this has taken a while, so I appreciate you being very patient with me and with Mr. Fotheringham. He's also looking at putting some monitoring equipment in his house. What is the language regarding reimbursement for monitoring equipment services?
Just one moment, please. Per this particular policy, monitoring equipment is covered.
And what is the rate that it covers it at? It looks like I'm seeing
200, and per the policy, it shows that it cannot exceed 5% of the monthly benefits, and the benefit is $225 a month.
Okay. Does the plan of care have to include the monitoring equipment in it as well?
Just one moment. Yes, the plan of care will need to include the monitoring equipment as well.
Okay. And does there need to be some form of lease or rental of the equipment?
Just one moment. Per the policy guidelines, we will only pay for 12 months of service, must have a rental or lease agreement signed, and must include the plan of care.
Okay, great, thank you very much. We're just about done, I think, so I appreciate you being patient with us.
Oh, no problem, Mr. Christensen.
Respite care. Does the policy have respite care on it?
Per the policy, there is respite care, but it cannot exceed the monthly benefit in a 12-month period. And his monthly benefit is $4,500.
Okay. And is the respite period subject to the elimination period?
Hold on a moment while I gather that information. Per this particular policy, respite care is not subject to the elimination period.
Okay, great, thank you. Well, Michelle, you've been very helpful. I appreciate everything that you've provided us with. When we file a claim, what are you going to need to file a claim?
Okay. To file a claim on this particular policy, you will need a copy of the original assessment done by a healthcare professional, a written plan of care, a copy of the home care for home health license, an itemized daily bill, and the daily care notes.
Okay, well, great. And how long does it take to process your claim, the initial claim?
All claims take approximately 30 days for processing.
Okay, and are those business days or calendar days?
Those are business days.
You know, one thing I almost forgot, and that's probably the most important part, is the activities of daily living. How it looks like maybe 2 or 3 activities of daily living need to be triggered. Is that correct?
That is correct. Per the policy guidelines, the policyholder must need 2 or 3 of the activities of daily living.
Great. Now, are they hands-on assistance or can it be standby assistance?
One moment while I pull that information. Per the policy, assistance can be hands-on or standby.
Okay, well, great. So so he needs to have 2 activities of daily living, and those can be hands-on or standby, is what I heard you say.
That is correct.
Well, great. I think I covered everything. Mr. Fatherham, do you have any more questions?
No.
Well, great. Well, thank you very much. You've been more than helpful.
Not a problem. Thank you for calling Long-Term Care Insurance Company. You have a good day.
Thank you. All right, so that's the basic steps that you're going to need to go through. I believe I hit everything that's in there. Again, you're going to want to make sure that you cover the elimination period, that you have a good understanding of everything around the elimination period. Does it cover home care and facility care? Even though you're only possibly doing facility care, down the road you may need to do a placement and need to know what the benefits are for a placement. The daily benefit amount, does it pay out daily or weekly or monthly? In this case, it paid out monthly. Does it pay out daily or weekly on a facility? This one paid out on a facility on a daily basis. Hands-on assistance or standby assistance, and this one, of course, it could be either one of them. So once you put it all in on the form here, make sure that goes in the client's file. It should be in your electronic sheet there, and this is a critical point, part of doing the assessment, so that you can make sure that you're providing adequate coverage. So hope that's been helpful, and we'll go through a little bit more details on long-term care insurance training in another training class.